Cool. Hi, everybody. We're just going to give maybe 5 minutes to let some people join in, and then we'll get everything started and rolling for you, all right? Okay, guys, we'll go ahead and get started now. Welcome. First of all, thank you very much. This is our first event. We're super excited. We're Pre-PAPals, so we started this group just to give back to the PA community right now, Pre-PA community specifically. We know it's really hard for you guys to get shadowing in, and we want to just try and give you as many hours as possible, the best information we can provide you guys with. We're going to try to have weekly events. We have one scheduled for next week as well, and then a few in November. So we'll definitely keep you updated. If y'all will just follow us on Instagram, or you can subscribe to our YouTube, and we'll keep you posted.
And then just keep your eye out throughout the presentation. We'll have like a short quiz at the end, and we'll post the link to that in the chat on YouTube, and then on our link, in our bio on Instagram as well.
Awesome. And if you guys will, please be as active as you like in the chat. Talk as much as you want. We're going to keep an eye on it, and we're going to do a Q&A at the end. So we'd love to hear the questions that you guys have to ask for maybe even us, or definitely for Ngan. But yeah, guys, we'll go ahead and jump straight in. We know you're not here to hear us talk. We're here to hear from Ngan. So she's been waiting patiently. Here she is. Please take it away. You can go ahead and share your screen.
All right, guys, give me just one moment to flip to my screen.
Yeah, absolutely.
I'm sorry, guys. There's always a little bit of technical difficulties trying to share just one part of my screen. Okay, can you guys see my screen okay?
Yeah, we can see it perfectly.
All right, okay. Well, thank you again for the introduction. For those that don't know me, my name is Ngan, and today's focus will be a day in the life of an inpatient infectious disease PA. A little bit about myself. I still consider myself an early career PA. I've been out practicing now for about 2.5 years. Prior to my start actually began in ENT, or otolaryngology, and just thanks to the pandemic, I had the opportunity to transition to infectious disease. Aside from working as a full-time PA, I really enjoy pre-PA mentoring, most specifically as a mock interview coach, and I do that on the side with the PA platform. I haven't had too much time since my transition, but in the past I am now trying to get back to it. But I do also have a blog where I try to educate on just, fun facts or just interesting aspects of that specialty. And then my new adventure is actually co-hosting a podcast with my fellow IDPA friend Josh at Family Time. So if this is something you want to venture out, this is specifically, we wanted to create a podcast that delve, although bits of medicine, but really just to share our aspects, kind of growing up, as a person of color working in medicine. So if this is something you may be interested in, I encourage you to check it out. A little bit more about my background. I am originally, I guess I don't want to say originally, but I am from South Florida. I attended the Florida Atlantic University for my undergrad, got my bio degree. During this time, way back when, there really wasn't a lot of commotion around the PA profession. Of course, you had your AMSA, Pre-PAPals Society, but there wasn't exactly a pre-PA club at that time. So I was involved. We had a health organization that was kind of multidisciplinary type thing called the Pre-Professional Club. So I was involved for those few years. And then my senior year, I was the club's organization's president. I also had the opportunity to go on a medical mission trip to the Dominican with part of the university. And after graduating, all along I was kind of this pre-med, pre-health kid, didn't really know, thought I had my heart set on going to medical school. And so it really wasn't until halfway through my master's degree where I went to University of South Florida in Tampa to receive my master's in public health, kind of while sitting there working as an epidemiologist, did I realize, you don't really want to go to med school. So what are your other options? And kind of at that moment, it's when the light bulb kind of clicked and I investigated or looked into the PA program or PA profession a little bit more and realized that may be more fitting with what I wanted to do. I also was very involved there with the program and had another opportunity to go on a medical mission trip, this time to Panama. And like I said, once I knew that I had to transition to apply for PA school, I knew that I was lacking those patient care hours. So I switched because my epidemiology was more patient education. And so I knew that I needed those hands-on hours and took my next step as a medical assistant working at our health department in the HIV clinic, which is kind of where or how it's all circling back now that I'm working in ID. Fast forward a little bit, in 2015, I received my acceptance and I went off to FIU down in Miami for PA school, graduated as an inaugural member. So the first cohort, which is never really easy, you're kind of as a guinea pig. And so if those of you that have any specific questions about our new program, what that was like, please feel free to reach out to me. Of course, during this time, I was also heavily involved in just advocating for the PA profession. I was the diversity chair of my class. I had the opportunity for 2 years to serve with the American Academy of PA as a student delegate. And so, my most proud moment was, sitting on the House floor voting for major bills, as you might have heard, optimal team practice or OTP. And then the following year, voting on the title change, which, as you all know, we're still pending the final recommendations on whether or not we should kind of rebrand our title from physician assistant to another title. So I would say for those that are interested or have been following me on Instagram from PA Week last week, you knew that that's all I talked about was how to get involved in PA advocacy. So if you're new and you're seeing this for the first time, please go and follow my page and to learn more about that. But really why you're here today is to learn more about, infectious disease as a specialty. So kind of why did I pick ID? And so, as I just mentioned, my background is in infection control. I mean, I got a whole master's degree on that. I had the opportunity, very blessed, to have worked in epidemiology. I worked in 2 different health departments originally. I was hired to kind of investigate, chronic hepatitis C in young adults, and just trying to figure out, well, why is it that this population is, what are their risk factors? Because we know that the baby boomers have one, huge peak, but then why is it that young adults are getting infected? So I had the opportunity to work on a grant-funded project on that for a little bit. I also then switched to a different health department, and this was back in 2015. So for those, and some of you might be too young to remember, but this is kind of like the big go around of when Ebola kind of came back. So, all these crazy outbreaks that are coming back. So I think naturally it's very fitting that with the biggest pandemic of our lifetime that I had to go back to ID. And then, of course, honestly, with my current position, it's all thanks to my experience working in an HIV clinic. One of the attendings I work with is actually someone that I knew who was in training back in the day. So it's important to, network, keep a good relationship, because we never know when an opportunity may kind of present itself again. So that was something that kind of gave me my foot into ID. Another big reason for infectious disease is just a huge component of public health and community education. I can't think of any other specialty where you have the opportunity to really make a difference. I mean, I would say public health, or mainly ID, it affects everyone. If you have an organ, then it can be infected. So I think it is such just a really big, comprehensive type of specialty that really captures, effects from the affluent to those that are underserved. So we can certainly make a big difference in ID. I think it's also wonderful to kind of take note of a profession that has just incredible progress. When we think back from the 80s of, the HIV pandemic, or now I guess epidemic, and just, HIV used to be kind of like a death sentence. People just didn't really know how to manage it. And now patients can be on antiretroviral medications and live as if they just have any other chronic condition. So that has been a huge change. You've seen diseases such as smallpox that has been eradicated, and that's all thanks to the efforts of vaccinations. And so, and then with hepatitis C, like I mentioned, a few years ago when I was working at the health department, it was always really heartbreaking to tell these individuals that, hey, you've been exposed, have hepatitis C. And they're like, oh gosh, what's next? But now it's nice to say that there are treatment options. So I think, when you're looking at a specialty standpoint, ID just has that that scope, that duration, like this huge progress of just making a difference in people's lives. And, one day, as tough as it may appear right now, we will get past this pandemic and we will have a vaccine. And so it's just kind of being there in the forefront to kind of see it all. Of course, working in ID, there are plenty of opportunities for research. Again, hate to make this all about COVID, but certainly with this pandemic, a lot of the treatments you've heard currently with our president and all these experimental medications. So, ID, I think, is always in the forefront. We're always trying to research new medications, and ways to treat certain diseases and conditions. I think another reason why ID is just, it's exciting, right? A lot of times I kind of like to think of myself as, house. Whatever the primary care, the internist, they may not have an idea of what's going on. And so then it's up to you to really put on that, magnifying glass and try to figure out what else is going on, what else can be contributing. And so it's nice to kind of, if you're someone that's curious, who has this curiosity to, who really want to put all the pieces together, ID might be fitting for you. And then, of course, ID is also very challenging. You know, I mentioned earlier, Ebola came back a few years ago, certainly with COVID and just having something so novel, so new. Um, in a way, it just aligns with public health goals of, you know, just trying to, in a way, keep up and be ahead of the game in terms of what the disease may bring. So certainly there are some challenges, but I think, you know, with time, just being able to see the progress, something that is unique that maybe other specialties may not have the opportunity to always have. So what does it take to become an IDPA? I would say patience. Certainly, like I said, just the fact of the unknown. Sometimes you have to have good faith, have that patience to keep moving forward. You know, certainly I think being a lifelong learner kind of applies to all area of medicine, but certainly being an ID specific, you always kind of have to read up and have that evidence, because a lot of times you just don't know, but based on the evidence of the current literature, you can kind of put two and two together and be like, well, you know, I don't have the entire picture, but based on this model, this is kind of what's to be expected. Certainly for those that are interested in research, there's tons of opportunities. You know, there's always something to look at. I think being adaptable is kind of the number one rule of being a PA. I remember that was kind of like my first lesson during PA school orientation was you always have to roll with the punches. And I think, again, that's what makes PA so unique. And certainly with my background in public health, that was partly why I chose PA, was just having the ability to kind of adapt to my community's needs. And most certainly just someone who is inquisitive, who just always has the curiosity to know why or what else can we do. And so I think those are all great characteristics of what it takes to be an IDPA. So one common question that I typically get asked is, does PA school prepare you, you know, for your current position? And certainly as with a career in infectious disease. Well, the short answer is no. You know, there may be some programs that have an emphasis on, you know, infectious disease, but reality, aside from the typical, you know, clinical medicine and a little bit of infectious disease that you learn with each, you know, organ system, there really wasn't a lot of emphasis in infectious disease. You know, you had your microbiome, which you kind of learn, you know, even from undergrad, and kind of go a little bit more in great lengths during PA school. And then, of course, learning the antibiotics and pharmacology. But there was never a great opportunity to kind of really apply it. And I think it's unfortunate because, you know, eventually once you're in PA school, you'll learn to become more familiar with the NCCPA blueprint. And so this is a blueprint that essentially is what the PANTS, or what the PA boards kind of has broken down. And I want to say that infectious disease makes a very small percentage. I want to say maybe 10%, but reality, like I said earlier, if you have an organ system or an organ, that can get infected. And so I think ID, although it's not specifically its own big, like, you know, system, it is still built in. You'll still have questions built in each of these systems or organ systems. So really, PA school didn't prepare me. I decided to, you know, do more of like a surgical subspecialty for my rotation. So I actually did not have the opportunity to rotate in ID. But this is something that I definitely recommend because, like I said, it's kind of everywhere. So something to consider. But PA school, you know, kind of lay out the foundation, give you the basics, but doesn't necessarily give you all of the tools. And, you know, what it takes to become an ID physician, right? So you've, of course, gone through medical school. You then go through 3 years of internal medicine residency and then a 2-year fellowship to become an ID physician. So sometimes, especially now that I'm so early into the field of ID, I have to remind myself that, hey, quit comparing yourself to your attendings. You know, you have to give it time. They've had years of training. And so you just have to go with it. But I think what PA school does do well is, of course, they teach you how to get a history, how to perform a physical exam, knowing what is abnormal. And I think the key to doing well in ID is just always just being able to ask questions, knowing when something isn't right, and then, whether it's collaborating with your attendings or whomever, but just always trying to find other reasonings to get to the solution. In terms of a scope of practice, what can an IDPA do? So I mentioned earlier, of course, performing or taking a history, performing a physical exam. We have the ability to diagnose and treat. One thing I did not really know, which I don't know why I wasn't thinking, but essentially in ID, there's a lot of wound care involved. So if this is something that you're interested in, wanting to learn or having additional skill set, I think wound care can definitely be beneficial. Another thing that I did not really know of is in terms of ID as a specialty, you're really used or utilized as a consultant. I came from a specialty background as well, but with surgery, it's kind of like, okay, does this patient need surgery or not? And so with ID, it's more than just, hey, what antibiotic does this individual need? You can also be utilized to consult in terms of like pre-op, post-op for patients with surgeries, right? Patients with transplants, patients that are immunocompromised. It's more than just, hey, these patients are all having these like multi-drug resistant bugs. What else can we treat them? And so it goes beyond just being there for your health colleagues. I think it also goes into your community. If say you have a local outbreak in a nursing facility, then that individual that practice may also reach out to you for advice, and of course the public. And so I think it really goes beyond just the typical kind of for the patient. And then the one thing that I do kind of miss, leaving EMT to go to ID, is that there are no procedures. And so for those of you that really love procedures, then ID may not be able to fulfill that for you. So what does a typical day look like? For me, I currently, on average work from 8 to 4:30 Monday through Friday. I am very fortunate that I don't have to take any weekends. There are no calls. Currently in my position, I work predominantly inpatient, meaning I only work the hospital side and get consulted to go to the bedside to see these patients. But I'm hoping that I'll eventually have the opportunity to kind of switch and rotate to outpatient. I think part of the reason why I took this position was to really go back to my HIV roots. And so this is something that I'm looking forward to learning more and hopefully being able to serve my community in that way. But on a typical day, I arrive to the clinic around 8 o'clock. I log on to our EMR. I check to see if we have any new patient consults, kind of keep a running list of myself, and then share that list either with my attending. Sometimes we do have a resident, and so kind of splitting up the list there. Once I get my list, of course, I go to the patient's charts, kind of learn a little bit more about them, figure out why are we being consulted, what medications are they on, of course, looking at their labs, seeing, are there any other concerns in terms of their kidney or liver function that might have to play a role? Are there any allergies to antibiotics? And these are things I have to keep in the back of my mind as I'm planning on a treatment for them. So once I kind of have my labs and all the pertinent, like imaging, path report, culture report, whatever it is that I need to know, I then, kind of walk halfway across the hospital and then start rounding on these patients. I go in, of course, I get, although I've seen the history, and the one good thing about being an ID consult is most of it's already laid out. So you have a good idea, but of course the story kind of changes. For those of you that are on rotations, that as soon as a preceptor comes in or an attending comes in, the patient changes the story dramatically. So whatever, depending on the patient's mood of the day, you go in, you get history, confirm that everything is correct, make sure that nothing else is missed. Of course, performing the physical exam. And then At some point, I meet up with my team, whether it's the resident and the attending or just the attending alone, and kind of round these patients together. Currently, and again, this really depends on the facility that you work at, but with any new consult that I see, I am expected to be able to round or, have that note co-signed with my physician. And so we'll kind of continue that for about, a couple of hours. It just really depends on the patient load. On an average day, I can see about 7 to 8 patients. Again, I do work in a very exclusive type of hospital, but typical like private practice hospital can see upwards of 20 patients a day. So just, again, something to keep in mind depending on where you may want to work at. And then around noon or so, I would say we're typically break because then the residents go off to their lunch meetings. I use this time, depending good or bad, depending on my mood. Sometimes I'll either work through lunch and kind of chart while eating lunch. Other times, I also do have, we have these roundtable discussions. And so just depends on the day. And then the afternoon, after 1 o'clock, usually it's when I'll have a chance to kind of sit down back at my desk, finish up my notes, review any labs, do more what I would say the not so fun side of being a PA, which is a lot of administrative work, making sure the orders are all placed in, any refills, whatever else, and try to get my day prepared for the, or have my list updated for the following morning. So in a nutshell, that's kind of what my day looks like. So morning is very heavy, seeing a lot more patients, but then the afternoon, kind of sitting down, having some downtime to do my notes. And of course, if there's any new consults in between, typically around 2 or 3 o'clock is when I'll make my second round to go back to the hospital and see those patients. So what are some things, common diagnoses or infections that I see in the ID? Particularly at my practice, we do a lot of bone and joint infections. So this is new to me, coming from an ENT background, knowing that the numbers of Americans that are, plagued with comorbidities from diabetes, obesity, hypertension, hyperlipidemia, you name it, that all affects, the body. Certainly, diabetes makes it really tough for wound management. And so a lot of times I'll see these essentially bone infections where, diabetics, for those that suffer severely, develop diabetic neuropathy where patients just can't feel their feet very well. And that's why it's recommended for them to go and see their primary care to get these kind of like annual feet exam. But because these individuals can't feel any pain, they may not notice that there is a cut. And so over time, that cut, that open wound can get infected. It may start out with just kind of the soft skin, cellulitis type thing. But with time, if that area gets so bad, that can then seed and the bone itself can be infected, and in which case, surgery, podiatry may need to be involved, either amputating a toe, sometimes multiple toes, sometimes we're talking foot, ankles, knees, and it gets pretty out there. And I think this is something that I'm seeing more and more of, especially with COVID. A lot of patients are unable to physically see their PCP. So I am seeing kind of the consequences of that lack of access to care during this time. Of course, I didn't mention earlier, but yes, we do have a COVID service. Initially, when I was working, I did see COVID patients. I was the one kind of in charge of seeing whether or not a patient would benefit from some of those experimental antiviral medications, and whether or not they may be a candidate for convalescent plasma. And so currently, for the last 2 months, I stepped away from COVID, but unfortunately, COVID is still out there in our communities. We just have a different service, meaning we have a different provider that sees only those COVID patients and act as their consultants. Of course, we see HIV patients, patients with sexually transmitted infections, hepatitis, there's A, there's B, C, there's actually more, but generally B and C are the ones we commonly deal with. Endocarditis, I mentioned earlier, sometimes we get consulted. So essentially endocarditis is an infection of the heart valve. And so that gets really complicated. These patients get really sick, and it's vital, especially if these patients have any type of pacemaker, any type of wiring implant. It's really important to work them up and treat pretty aggressively. Of course, we also deal with blood infections. And then another common reason why you would consult ID is if a patient suffers and have multiple drug resistant. So the typical antibiotics may not be permissible to be prescribed by one like PCP or, the internal medicine folks, that there are certain antibiotics, antifungals, antivirals that are exclusive that only an infectious disease provider can prescribe. So for those reasons, that's when we would kind of see those individuals. So what are the pros and cons of working in infectious disease? I think the biggest pro, like I said, for those that may have an emphasis in working in public health, you certainly can make a big difference here. I think it's also unique to be able to kind of serve as a consultant, just as you imagine radiology or pathology, being able to kind of serve kind of on that, kind of secondary to a patient's care. But the biggest con, I would say, is you have to feel comfortable with just not knowing things at times. You have to be okay with the unknown. So again, I think COVID is the biggest example. When we first, when the pandemic first started, no one really knew what was the best management. And so kind of took a few trials, looking back, seeing the patterns of how this virus compares to others. Were we able to kind of figure out a plan that we think seems to, I think it's doing a lot better than where we were a few months ago. So I would say those are definitely my biggest pros and cons. So my last piece of advice for those that may be interested in infectious disease, like I said, unfortunately, PA school doesn't have a big emphasis on ID. And so I encourage you, for anyone, it's always great, kind of secondary knowledge to have, because like I said, if you have an organ, it can be infected. And so you want to be able to kind of expose yourself. So take the opportunity. If your program doesn't have a mandatory rotation, maybe that's something you might want to ask. Spend a few weeks in ID, just kind of have an understanding what's going on. Of course, network, that kind of also goes with the rotation. And then for those that, are unsure still and later want to go back into the ID world, I think having a solid internal medicine background is important. That's something that I'm newly learning, that it's really internal medicine plus all of pharmacology. So, the curve is a little bit steep, but I think it's still exciting, and there are lots of opportunities to learn and kind of contribute. So. And with that, I will take any questions. And then my last slide here is just my contact info for you to find me. But I am available if anyone has any questions at this time.
Okay, perfect. Man, that was amazing. Thank you so much. We really appreciate you again. And what a perfect time for an IDPA to come on, right? With COVID and everything.
Yes, I don't know. Sometimes I question myself. It's like, Ngan, what were you thinking? You just jump straight into the fire, right? Like I essentially found out about the position in April, and by July, I was already there. So it's pretty crazy.
Well, it sounds like you're very busy. And I do know that today is Tuesday, so you're not off and you're still doing this. I really appreciate it. That's insane. Like you clearly care about Pre-PA community. Like very cool of you. Thank you so much. I'm sure on behalf of everybody here, we have 110 plus viewers right now. So this is crazy. Really appreciate you guys for tuning in. Like we said, we're gonna keep doing this stuff, and we're gonna plug our all of our social media and stuff at the end. But y'all have asked some amazing questions, and now, if you don't mind, we'll relay some of them to you.
Yeah, absolutely.
Perfect. Okay, go ahead and start it off.
Okay. So here. So someone said, would you say that having connections for job opportunities is important?
Yes, definitely. I think it never hurts. And this is why on rotations, you always want to be friendly and kind. I think a simple thank you goes a long way. In this particular case, the attending that invited me to work in their practice was actually one of my letter of recommendations from back in the day too. So it really does go full circle. But yes, I think a lot of jobs, unfortunately, are not posted. And so sometimes it's just by word of mouth, and just knowing someone is the best way to get involved. So, but until then, you never know who's a connection. So just, keep in mind when you're on rotations to be kind to everyone and thank them, because you never know when they'll be thinking of you for the next job opportunity.
Sure. Yeah. So it's really important just to put yourself out there, right? You never know who will come back later in the future to help. Awesome. Okay. So let's see. We have some other really good questions. Do you have a favorite or most memorable experience as an IDPA so far?
Oh gosh. So I've only been in ID now for about 3 months. I think there are things, especially working back in my public health days, kind of as a disease investigator, there are some things that scares me. So for example, because of this pandemic, I recently got into one of my new hobbies is, planting houseplants. And so one of the common questions that, sometimes depending on the case, I would ask a patient, what are their hobbies? And knowing that with certain plants, gardening, that spores can come out. So I don't want to say that it's interesting per se, but it's always a thought process in the back of my mind, like, Nan, what are you exposing yourself today? Great. Good news is that I'm, well, and I'm, competent, but what if my immune system wasn't? What could I be exposing myself in these, soil as I'm watering and playing around with the dirt? But in terms of interesting cases, I think right now what I'm seeing a lot is chronic changes because of the backlog. And this is something that I actually have been thinking a lot about and want to know from my colleagues is how has COVID affected their practice, right? Aside from the fact that patients, their volume has decreased, but for those that, have been practicing or been working all along, what type of conditions have they seen that's changed dramatically? Because like I said, right now I'm seeing a lot of patients with diabetic foot ulcers that unfortunately are so severe that they require amputations and other surgeries.
I see. Okay. Wow. That's pretty interesting how you can relate plants back to. So basically,
And it also goes with, with anything from pets. So I was saying, on a side tangent, that just brought me to my attention. So salmonella, right? We probably heard of that. We know eggs, uncooked foods from chicken in particular can carry salmonella. And so we, a couple of weeks ago, had an interesting case where I've always thought salmonella was pretty harmless, but in this particular case, we've seen secondary effects of it. And so as I'm learning, a really, really bad case of salmonella can cause colitis, or in other words, inflammation of, your intestines. So it kind of makes you caution what you're eating. So I don't know, maybe if you have, or somewhat, what's the word? A hypochondriac, maybe ID isn't for you either. So.
Right. Yes, absolutely. Okay, let's see what else we got here.
Someone wants to know, what do you miss about being an ENT?
So right now, I think in my current role, inpatient, and how that differs from outpatient is you don't have that continuity of care, right? You generally see patients that are acutely ill. You might follow them at most probably for weeks, sometimes even a month or two at a time, but then you never really see them again after making these connections with them. So the one big aspect that I miss about outpatient, and probably with ENT, and with my background in my previous role, I did a lot of like sinus patient and management. So I would see these patients every 2 to 3 months. So I just miss that continuity of care.
Sure. Wow, that's incredible. I mean, there's a lot of providers that don't even want to see their patients. They'll do the surgery and not want to do rounds because they're like, no, I'm done. I don't want to have to think and talk, you know? So that's incredible. That shows that you really care. Like, we appreciate that. Let's see what else we have here. Do you have any tips on study techniques that you think are effective for maybe undergrad or PA school, or any sacrifices you have to make when you do those sorts of things?
So I think, I want to commend anyone that is studying or trying to pursue medicine. I think for so much of your career, your young adulthood, you are slaving away over books. It is definitely a sacrifice, and definitely kudos to your friends and your families who are supporters. It hasn't been easy. I didn't share, but for me, through this process, I graduated from undergrad in 2011. I graduated PA school in 2017. So, but the process, it took me from start to finish, or actually I should backtrack. I graduated high school in 2007. So it was a 10-year journey for me to get from point A to point B. So, in terms of undergrad, gosh, that was so many moons ago. I don't know if I can give the best advice, but in terms of PA school and what to do, you'll find your own rhythm. Full disclosure for me, initially, I almost threw in the towel at 2 months during PA school. I was just beside myself. Although I just graduated from my graduate program, I just felt like I couldn't do, but I think the big thing here for those that have accepted and feeling lost and frustrated and overwhelmed by the sheer volume of information, just remind yourself of kind of why you started. Take it one day at a time, take it one class, one exam at a time, and eventually you'll get there. And to quote one of our former clinical directors, he always said, always asked us, how do you eat an elephant? And the answer is one bite at a time. So kind of the same analogy, just take it day by day. You'll find your rhythm. Each class will be different. But for those that are struggling, I think, certainly YouTube, even the amount of resources out there are just tremendous. So don't overwhelm yourself. Maybe pick to one or a few resources, ask for help. There's always someone that's willing to help you, but I think you have to speak up and kind of know when you're struggling.
That's awesome. I like that. I'm going to try and remember that elephant analogy.
Yes.
I like that. So yeah, kind of piggybacking off of that question, we know that you have to spend a lot of time studying. Is it worth it once you're finally there? Are you happy? How's the work-life balance? A lot of people were asking about, financial stability because of your loans, and just in general, how do you feel now?
So this is like a loaded question. I think there's a lot. I will be truthfully honest that medicine isn't what I thought it would be. Yes, it's so gratifying when you can be there for a patient and really work them through their medical problems. However, I think there's an ugly side to medicine, and a lot of that has to do with who is hiring the medical providers. That goes a lot into kind of these insurances, and probably can get a lot of heat, but it's from the admins. And if you just kind of think about it, just look at what's going on with this pandemic where, health providers are being furloughed. So I think the best way to combat this is just to really get involved with your profession. Like I said, I spent all of last week with PA week just trying to advocate and educate on why we need to be involved. PAs, we are a small, newer profession. We don't have as strong of a voice. And so I think as the profession continues to grow, and it will, we all need to stand and support one another. Unfortunately, student loans will always be there. It depends. Some people are really aggressive. I'm just making my payments month to month. But I think at the end of the day, I will say this is still the best job I've had. But with that being said, it's still a job. There will be good and bad. But I think what keeps me somewhat grounded is just to always remember why I've started.
Amazing. Yeah, that's awesome. It seems like your heart is in the right place then, right? I always hear people talk about don't go into medicine for money, because
Yes.
how many hours you work versus how much you're making an hour, that you're going to make yourself cry at the end of the day.
And even then, even when that's not the case, you're still going to cry. So be prepared for a lot of those tears, even after PA school.
Gotcha. Okay. Do you mind taking a few more questions?
Sure, no, we're good.
Maybe like 5 more, and then we'll call it. Is that all right?
Sure.
Perfect. So somebody's asking, do you have a recommendation on what sort of PCE that PA schools will consider? Is there like a tier list? Do things count better than others, or what's your opinion?
I would, refer you to a program that you're most interested in. They will break it down. But in the end, this is a question I commonly get asked. And in the end, I feel like it's, you're still living your life regardless, right? Yes, you're working towards a dream, your goal of becoming a PA, but you should find a role that you feel like you can fit best, that you can still learn and enjoy. Even if it's just a job, a stepping stone, you have to find ways to enjoy it. And so I was very fortunate in my role as a medical assistant. I did not have to be certified. For those that are asking, well, how did you find a job without being certified? I would reach out maybe to a health department, to maybe a smaller clinic who will be able to train you. And so, don't get so hung up saying that you have to have all of these hours, because any experience, anything you put your mind and effort into, it's great experience and will help shape you to be the provider that you hope to be. But I would say, you still have to live your life. So figure out what you think you may enjoy the best.
Awesome. And so what we've seen in our experience is there's all variety of people doing PCE, from scribe, EMT, MA like you, there's all sorts of things. And I feel like there's different aspects of each job that can help you in the future, right? So maybe it's not so much one being better than the other, but just how you talk about it, how you present it, personal statement, all of this kind of thing, right?
Exactly, 100%. And I think one of the roles that I think is really exciting, that's up and coming, is a position in clinical research assistant. And so, you kind of get the best of both worlds. You have the opportunity to do research, depending on what type of facility you're at, what type of research. You may also have the opportunity to actually deal with patients directly too. So I think that's something that, if you're fortunate and live in a larger city with a large medical university, consider that. And I know that PA schools have also will accept those hours as well.
That's awesome. I've never even heard of that. Appreciate it.
And most of these, unfortunately, right, it's kind of the big pharma that will send you out for trainings and studies, or to different areas. My significant other actually has been a CRA for a few years. And so I remember one year, actually, he used to work in HIV research as well, and had the opportunity to fly out to San Francisco. So kind of the best of both worlds: travel, work, play,
Perks of the job.
Yes.
Nice. Okay, so we have somebody asking about your relationship with your physician. How is it? We know, I mean, PA is very dependent on your relationship with your supervising physician. It can go one of two ways, so we just want to know a little bit more about how yours is, if there's any details you'd like to share about that.
Yeah, so in my current practice, we have 5 physicians, and I'm the only APP, or advanced practice provider, the only first and only PA for the time being. And so, everyone's schedule kind of rotates through. Like I said, we have one that does inpatient with me, one right now, as our COVID cases are still pretty high, one that sees only the COVID cases and doing some other outpatient urgent emergency type calls. The rest will kind of rotate and have their patients in clinics. And so right now, again, I'm still new, so I'm kind of still in that probational period. But, the attendings are always readily available. If I have questions, they are there. But right now, with my current institution, I'm only mandated that with any new patients that I need them to kind of co-sign. And so generally, I think it's always, I'm just so amazed when I work with my docs, that their knowledge, it's just, how do you know so much? So yeah, I would say we do definitely have a close relationship. And so for those that are pre-PAs, I know with COVID, it still is a challenge, but hopefully once things, get a little bit better, I encourage you that when you do have the opportunity to shadow in person, person, take a close look at that relationship between the physician and the PA, because that will come up, when it comes to your personal statement, your actual interview, having that understanding of how PAs and physicians kind of work together, because every place will be different.
That's very interesting. Yeah, congratulations. It sounds like you're groundbreaking at your clinic there.
Yes, thank you.
And generally, when I consider the relationship between PA and supervising physician, I just think one-to-one. The ones that I have shadow, it's just like one surgeon, one PA, something like that. But in your case, you have multiple, so you have plethora of knowledge to always reach out to.
Yes, and then with that, it's right, it's kind of like a double-edged sword. It's great to have a one-on-one, and even with my previous practice, we were also a large, I think a practice of 10. Granted, there were, I think, 7 of us in total, but 10 physicians and 7 APPs, but I never had that luxury of a one-on-one, so I can't comment. I would say probably the hardest part of working with so many different attendings, one, it's great because you get to pick on everyone's kind of knowledge and kind of craft your own, because I think at the end of the day, they call it an art, the art of practicing medicine. So I kind of pick and choose how I want to, what my style of medicine is. But the edge, the other side to this is having to learn all their personalities. How do they like things to be documented? How do they like things to be phrased? And so all of that does get a little bit tricky. And so when you only work with them maybe once a month, for a whole week, it does add a little bit of fun in there.
Yeah, definitely. I mean, physicians can be pretty intimidating sometimes. So having to deal with 5 of them all at once, I don't know how you do it, but that's cool. That sounds like an amazing experience for you. Let's see if we have any other questions.
So kind of going back to the PA advocacy, some kind of relating there. Someone wants to know, what title would you like the title to be changed to?
Oh, that's a good one. So originally, I voted just for simple and ease, right? I think from physician assistant, which I rarely actually call myself. I just say I'm a PA and call it that. To physician associate is the easiest, in terms of, having to change anything. However, more and more, I find that even that title, and I call it title more so than name for a reason. I think it's more than that. I feel like the physician associate title still is confusing. And if we're truly trying to rebrand ourselves, like, when you ask me, what are my goals or where do I see the profession? I think we certainly need to rebrand ourselves, and it's interesting. We can bring Dr. Eugene Stead back to life and kind of ask him what his thoughts on where the profession, how it is now, is it kind of what he envisioned? Like I said, I think healthcare is changing rapidly, and PAs are a huge player in terms of the medical team. And so I think we really need to, or we have adapted, but I think having that big rebranding will help us even more because I feel like a lot of challenges that lies in the profession has to do with people just not knowing what a PA is. And so for me, when I think hard on that, I don't even think physician associate is great enough. And I think something along the lines like a medical practitioner, something that says PAs practice medicine, bottom line. I think that might just be more clear.
Yeah, absolutely. That definitely seems like a stigma that PA runs into, is like, just because we have assistant in the title, people will think like, oh, you're a medical assistant or something along those lines, like you're directly doing whatever the doctor tells you, but yeah, that it definitely seems like we're going in the right direction. I'm seeing a lot more hospitals or physicians kind of realizing the utility behind a PA, like where they can put them into, kind of like you said, you're the first PA in your practice. So that's really cool that they're branching out a little bit and allowing, things like that to happen. So let's see, we have maybe a couple more questions. Kind of a general question back to PA school for you. Do you know if there was a psychiatry rotation? We know that the rotations can vary based on school to school.
So there are, I want to say, 7 core rotations. You have emergency medicine, pediatrics, psychiatry, mental health. There is women's health, there's surgery, internal medicine, and family medicine. So I would say, regardless of the program you go to, I hope I didn't repeat any of them. I just try to go in the order that I went for my rotations, but I believe there are 7 cores. Each program will be a little different. Some programs, these rotations can be either 2 weeks, a month, to 6 weeks, really depends on the program, and another reason why you need to kind of research and see if this is the right program for you. But in my particular program, is between 4 to 5 weeks of these core rotations. And then we had the opportunity to do 2 elective rotations. And so for me, I chose urology and dermatology, just because I'm really bad at describing lesions and wanted to push myself to learn a little bit more. And so
Awesome. And then maybe one final question. I think this is a pretty good one to end on. But somebody just wants to know, what do you think the future of the profession is going like? Do you think that it will become oversaturated? Do you think there's always going to be a job market, or any predictions that you have for the future of PA in general?
Good question. Compared to some of the other medical professions, there is still somewhat of a cap, just because majority of our training, our formal education, is done in person. Backtracking a little bit, people need medical access, so I think we are serving that need. Challenges, I think, again, it just really depends. It depends on how involved we are. I spend so much of my time, especially with my social media accounts, to kind of educate on why we need to do more. The profession's been around for 50 something years, and there are some people that are just too complacent, who really aren't speaking up, who, can turn the corner or, turn the eye because it doesn't affect them. But if you think about it, look at the pandemic, look at how many PAs, haven't you always heard that go to medicine for job security? Well, that's no longer the case. There were so many PAs that were furloughed. So thinking that, oh, I'm not affected today, well, don't let that ever happen again. We need to fight. Don't just fight for yourself, but fight for your brothers and sisters. So I leave that as a big question mark to you guys as the next generation that are joining the profession. Like, what do you want to make of it? We didn't get to becoming the top 10 profession listed by US Weekly or whomever just because we're awesome. I mean, that'd be nice, right? But it's because of the type of work we do. And I think for us to continue to be on the top, we have to continue to fight for those challenges.
Definitely. Absolutely. That is a great closing note for everybody here to think about. But yes, we cannot express how grateful we are for you joining us. Like, this has been amazing. So much great information. We really appreciate it. Please feel free to talk about any of your social media or anything that you want people here to join you on. If you want to take a sec, just.
Yeah, and also some people are asking where they can find your podcast.
I think it's pretty much available to any major podcasts. It's on iTunes now, it's on Spotify, so really on all the major listening channels. So we've had a few episodes out. We're always thinking of suggestions too. We don't want to make it too medicine focused because everyone always talks about medicine, but we want to make it something that's relatable. And for me, growing up as a first generation, growing up as a Vietnamese American, person of color, a woman practicing medicine, I find these at times be challenging. So I just kind of want to use this as an outlet and share my experiences, and so that that you're not alone on this, and again, try to form that type of community.
That definitely sounds interesting. We'll be sure to tune in. I'm hoping that a lot of people here will as well. But yeah, guys, I think that's everything. Thank you so much for tuning again. Like we said, we'll have videos hopefully every week. We already have one lined up for next week. We have a lot of dates in November we're going for. You can just follow us at our Instagram, which is
Pre-PAPals. It's a pre_PA.pals.
Okay, awesome. And we have our YouTube link there if you guys want to subscribe. Like we said, we'll keep you posted as best we can. Yeah, just in closing, thank you so much again, Nan. We really appreciate it.
Thank you guys for having me. I'm so honored to be the first speaker. So hopefully we can do this again soon.
Yeah, absolutely. All right. Well, thank you so much, everybody. Really appreciate it. And thank you again, Nan.
Bye, guys. Take care now.
Take care.
Bye.